Good day, Miss Barredo. I am Charles Angel Giger Galicano, and together with my teammates Galicia Hernani,
Ledesma Jose Paulo, Linka Sheena Marie, from Riverside College Incorporated, Bachelor of Science in Pharmacy. So we are the group 2 and we are assigned with a case about.
acute uncomplicated cystitis.
So here's our case. A 20-year-old woman attending college experiences increasing urinary frequency along with urgency and dysuria for 2 days. Over the next 12 hours, the symptoms persist until her urine appears pink or bloody. She then becomes concerned and goes to the campus student health clinic for advice. Vital signs are temperature 37.5 degrees Celsius, pulse rate with 104 beats per minute, respiratory rate with 20 breaths per minute, and blood pressure 100/70. The only abnormal finding on physical examination is mild tenderness to deep palpation in the suprapubic area. No genital ulcers are noted, and there is no vaginal discharge. The patient has no previous history of similar complaints. However, she has recently become sexually active and has been using a diaphragm with spermicide. So first, we checked first the vital signs. Temperature is 37.5 degrees Celsius, just a low-grade fever. Pulse rate with 104 beats per minute, which is a little increasing. Respiratory rate, 20 breaths per minute, which is normal, and a blood pressure of just an ideal blood pressure with a 100/70. And after that, we also check the symptoms or the patient complaints based on the case. So the first question is, what is your preliminary diagnosis and what test aid confirmation? So we decided, or we can, our first preliminary diagnosis is UTI and cystitis. Why? Because in the UTI, polyuria and dysuria. For your polyuria, it was indicated there that she has a frequent urination with urgency and dysuria. So these two could be a symptoms of UTI. And for cystitis, hematuria, since the patient is experiencing a urination with bloody or pink, and a low-grade fever, which is 37.5 degrees Celsius. So that too could be a symptoms of cystitis. So the laboratory test that we recommend is urinalysis for bacterial infection and pyuria. So for the second question, what is your final diagnosis and what is the most likely causative agent? So our final diagnosis is uncomplicated bacterial cystitis, just a mild version of cystitis. Since our patient or our 20-year-old patient is active, sexually active, that could be a risk or can increase the risk of acute cystitis and bladder infection in a woman. So we concluded that the causative agents are E. coli, other types of enteric bacteria like Enterobacteriaceae species, Proteus mirabilis, Staphylococcus saprophyticus, Enterococci, and group B Streptococci. So of course, additional lab tests based on physiological or biochemical traits are required to confirm this causative agents. So the third question is, what are the human's body natural defenses against infection like this one? So our human body has a lot of natural defenses. Urinary tract has several effective barriers. So the bladder is protected by urethra, the tube that drains urine from the body, and as in females, the urethra is shorter occasionally, allowing external bacteria to pass into the bladder. Also, why does the vagina is normally acidic? Because its acidity prevents harmful bacteria from growing and help maintains the number of protective bacteria. So E. coli bacteria, when they bind to the cells of the bladder, ureter, or urethra with their pili, our body natural produces a protein called uromodulin that is responsible to fight UTI infection. But because a female urethra is shorter, they are prone to bacterial infection. And also, one factor is that our patient is sexually active and has been using a diaphragm spermicide that can probably be a cause of her cystitis to develop. And for the last question, so how should this infection be treated? So we decided, or we recommend, our drug of choice, Bactrim, 160 milligram trimethoprim per 800 milligram sulfamethoxazole, Bactrim, orally every 12 hours for 14 days. And also we add up the management when you have a cystitis. Of course, you should change your birth control method, which is to stop using diaphragm spermicide, take oral contraceptive, and drink plenty of fluids. Since this patient is experiencing also symptoms of UTI, it is not recommended, or avoid alcohol, to drink alcohol, soda, and coffee, and drink cranberry juice to flush out the infection. And of course, always clean private parts after intercourse. And as a female, we recommend to avoid irritating or concentrated feminine product. Just use mild feminine wash as possible. And pee frequently. Pee if needed. Okay, so
These are our references.
and again, Ms. Barredo, thank you for sharing your knowledge with us. Thank you for assigning this case. I hope we answered all the question. Thank you, Miss, and God bless.